In this lecture, we are discussing about the topic kangaroo mother care. What is kangaroo mother care? It is the method of providing care to preterm and low birth weight babies. Method of care of preterm or low birth weight babies. Who is preterm? Neonate born before 37 weeks of gestation is known as preterm. Whereas low birth weight baby whose weight is less than 2.5 kg at birth is known as low birth weight baby. Here the infant is placed in skin to skin contact with the mother or any other caregiver. Heat transfers from mother to baby and protects the baby from hypothermia. Let us see some pictures. Here, the infant is placed in skin to skin contact with the mother. So, heat is transferred from mother to baby and protects the baby from hypothermia. KMC mainly focus on exclusive breastfeeding and early discharge of baby from hospital. Benefits. Benefits of KMC. It improves breastfeeding at discharge, reduces risk of mortality, and it promotes better bonding between mother and baby, reduces the length in hospital stay, protects from hypothermia, and reduces sepsis. When to start KMC? Best weight of the baby to start KMC is 1800 grams. Should be started in hemodynamically stable baby. And remember, KMC should never done in hemodynamically unstable baby. Started early after birth and ideally provided continuously for a prolonged period of time. Procedure. First, the baby should be placed in kangaroo's position. What is kangaroo's position? When we observe this picture, here the baby is placed between mother's breast. And the posture of the baby is vertically upright. And position of baby's face. Baby's head is turned to one side and slightly extended position. When we observe this picture, here the baby's head is turned to one side and it is slightly extended position. Why the baby's head is placed in extended position? This slightly extended head position keeps the airway open and allows eye-to-eye contact between the mother and baby. Position of the hip. Here the hips are flexed and abducted like frog's position, and arms, when we see the arms are flexed and they are also abducted. Next, baby's abdomen should be at the level of mother's epigastrium. Mother's breathing, because mother's breathing stimulates the baby, thus reducing the occurrence of apnea. Okay, posture of the baby is vertical or upright. Position of baby's face turned to one side, slightly extended position. Position of the hip flexed and abducted. Arms are flexed and baby's abdomen should be at the level of mother's epigastrium. This will stimulate the baby's breathing. Head should be covered. Monitoring. What should be monitored? The position should be monitored. Breathing should be monitored and temperature should be monitored. Always remember, the neck position is neither too flexed nor too extended. Next, feeding. Mother should be explained how to feed while the baby is in KMC position. We know that sucking is not developed in babies of less than 34 weeks. So, the baby is fed with paladi, spoon or tube depending upon the condition of the baby. Duration. How longer does the mother can keep the baby in KMC position? The period is variable. It can be up to 24 hours also. only interrupted for changing diapers. Long duration most preferred. Short duration of less than 1 hour per session should be avoided because frequent handling may cause stress to the baby. When KMC can be stopped? When the baby is of term gestation from birth, when the baby weighs greater than 2.5 kgs. Remember, when we start KMC, when the baby is preterm and when the baby weight is less than 2.5 kgs. We can stop the KMC when the neonate can no longer tolerate. How it can be indicated? By sweating of the baby or when the baby refuses to stay in KMC position. Criteria for eligibility. Baby's criteria indicated in all hemodynamically stable and low birth weight babies. Mother. All mothers can provide KMC irrespective of age, parity, culture, education and religion. Mother should be free from illness and willingness and good hygiene is more important. Clothing. Baby's clothing dressed with cap, socks, nappy, front open sleeved shirt. Mothers. Here in this picture, the mother wore front open garment and light dress. KMC works well with blouse and sari, gown and shawl. Next, the mother can sleep with baby in KMC position in reclined. Thank you.